What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. Today's episode is actually brought to us by Thrive Therapeutics. They're 5-in-1 calming gummies, non-melatonin, non-habit forming, a natural way to bring down your cortisol levels, which then helps your body get into the sleep that you truly need and deserve. Today's topic is about sleeping pills. 8 things you should know about sleeping pills, their risks, and is it right for you? What should you be doing? So we know that many people struggle with sleep issues. And what I find in my work with, doctors and patients is that this quest for a good night's sleep often leads patients or people to seek help from sleeping pills or sleeping aids. And these sleep aids can provide short-term relief from insomnia or other sleep disturbances. However, like anything else, they are not without their risks and potential drawbacks. So today the goal is for us to discuss and learn the various risks that might be associated with such medications. And I really want to shed light on the importance of cautious and informed use. You want to make sure you know. So let's start with what is the appeal of taking sleeping pills? Sleeping pills are also known as hypnotics or sedative medications. Doctors may prescribe them to patients to manage their sleep disorders, such as insomnia and sometimes even jet lag, actually. Or they may prescribe them to help patients cope with major life stressors, such as divorce, death in the family, job loss, major life incidents, if you know what I mean, that could interfere with your sleep. These aids, these sleeping pills are enticing because they offer a quick solution to the often debilitating effects of sleep deprivation. These medications that get prescribed or that people tend to take can be divided into 2 main categories. One is prescription. That is what your MD is going to write you a prescription for. Your dentist is not and will not write you a prescription for this. You have to make sure you're seeing your MD. And the other one is over the counter, of course. So prescription sleeping pills such as Ambien or Lunesta, a lot of times Valium. So Ambien is, the drug name is Zolpidem. Lunesta is Zopiclone, and then benzodiazepines such as diazepam or Valium are usually intended for short-term use. This is not meant to be a long-term solution. What they do is they work by suppressing the central nervous system, and this can then help induce sleep. The over-the-counter options, such as diphenhydramine, which we also know as Benadryl, and doxylamine, which is found in Unisom, are available without a prescription. These are your over-the-counter medications. However, it is super important that you understand that even the over-the-counter sleep aids should be used very cautiously. Know that you're talking to your doctor about it. And typically what I find is, speaking with doctors that I work with, it's not recommended that you take them longer than 2 weeks. Again, your individual situation might be different. You may be one that might only need to use it for an even shorter period of time, which is why it's so important that we talk to our MDs, we talk to our doctors, our healthcare providers, and making sure that we are doing what is best for us. Now, what are the risks of taking sleeping pills? The biggest one that I see and my concern is dependency and tolerance. What this means is that over time, those that use these sleeping pills or sleeping aids may become reliant on them, dependency, to fall asleep, which then ends up or can result in needing higher doses to make sure we achieve the same effect. And this then can create that vicious cycle where you find it increasingly challenging to fall asleep without these pills, but then you end up needing higher doses. Another concern with taking these sleep aids is cognitive impairment. So many of these sleeping pills can lead to cognitive impairment. They can cause drowsiness, They can affect concentration, memory, and even coordination the next morning. This morning after effect, almost like having a hangover, right, can be particularly problematic for people who need to drive, for people that need to operate machinery, or even perform tasks that require to be alert. So if you are a person that takes these, you want to make sure you have that 8-hour window to sleep it off, to make sure you're not getting behind the wheel if you are not at 100% alertness. And then we also have the various side effects, which could be dizziness or headaches or GI issues. A lot of people, well, I shouldn't say a lot, some people can also experience parasomnias while taking these medications. What are parasomnias? Sleepwalking, sleep eating, sleep driving. And in some cases, people don't remember experiencing these parasomnias after waking up. Why? Because sleeping pills depress the brain function and they limit thinking and memory. It's also important for us to remember that these sleeping aids or sleeping pills can have drug interactions with other medications that patients might be taking, and it could lead to dangerous consequences, especially if it is with other drugs that also have sedative effects, such as antihistamines or antidepressants or anti-anxiety medications, which is why it is super, super important to work with your healthcare provider. Make sure they know what it is that you're taking. If it's two different medical providers, make sure everybody's up to date on the list of drugs that you're taking, even if it is an over-the-counter medication. Another key point that's important to remember is you should not be drinking alcohol if you're taking these sleeping pills. Now, discontinuation of the sleeping pills can sometimes result in rebound insomnia or temporary worsening of your sleep problems. And this can be particularly challenging to manage, which is why it's so important and necessary to make sure you're working with your MDs to have a tapering off of these medications. Certain prescription sleeping pills, such as benzodiazepines, do have a higher risk of addiction. They can lead to physical as well as psychological dependence, making it difficult for people to stop using these even when they're no longer effective. Now, while these sleeping pills can help people fall asleep faster, a lot of times they don't result in the same sleep quality as natural sleep does. So this is where you end up waking up feeling groggy and actually less refreshed. Remember, we talked about the hangover effect earlier on. And then there's always the risk of overdose, right? Sometimes people may inadvertently take too many pills, which could result in an overdose, which can be life-threatening, especially with prescription sleep aids. So while sleeping pills can offer temporary relief from sleep problems, make sure you're aware of the potential risks. As I said earlier, they're best used as a short-term solution under the guidance of your healthcare provider. Avoid long-term use. Make sure you're working with your doctors. Help mitigate the risks of dependency and tolerance as well. Now, ultimately, the most effective approach to addressing sleep issues is to explore non-pharmacological methods, which means improving your sleep hygiene. We have previous episodes where I go into sleep hygiene in great detail. Make sure you check out that episode. Practicing cognitive behavioral therapy for insomnia, CBTI. Watch out for a detailed episode on CBTI coming up soon. We also have some great episodes with Sleep Doc Shelby and a couple of other docs where we go into CBTI. So make sure you check those out as well. Also performing stress reduction techniques such as yoga and meditation. So while these methods can help lead to long-lasting improvements in sleep quality, they also come without the risk associated with sleeping pills. So as always, make sure you're working with your healthcare provider. Make sure you're doing what is best for you, what is right for you, what fits with your health history, your sleep needs, and make sure you follow that path with the help of your healthcare professional. I hope this gives you some insight into sleeping aids if you have been considering going down that route to help you with your sleep issues. As always, leave us a review. I will see you next time.